with Home Health Success Academy. I just want to say thank you so much for joining me in another one of our free videos over here at Home Health Success Academy. So let me ask you guys this. How have your company differentiated itself from the rest of the competition? So I ask this because you need to be able to have different programs as well as different services that others don't provide or only few provide. So one of these that I want you to start trying is what we call the daily medication calls. Pretty much meaning that you will tell the doctors that your patients are going to be called on a daily basis. Not some patients, all your patients gets called on a daily basis to remind them to take their medications. Understand this, a lot of times people get readmitted back to the hospital because they're non-compliant or they forget to take their medications. So because of this, it's about medication management. And how do you do that? You remind them on a daily basis to take their medications. Now, if you hired one person to do this for you, it's going to take them the whole day to call about 100 patients. Now, understand this, you don't want your patients getting called at 8 o'clock in the morning because they're going to start getting mad at you guys, right? So imagine if there's a company out there that's going to be able to actually call your patients exactly every day at 5 o'clock to remind them and to say, hey, did you take your medications? Or if you had actually a patient who actually takes medications twice a day and they need to be called twice a day for reminders, imagine that. What would that do for you? That would, first of all, decrease the chance of those people getting readmitted back to the hospital, which means you won't have any LUPAs if you actually have a home health agency. You will actually be able to keep that patient for those 60 days that you're taking care of them, or if you need to readmit them, and so you want to make sure you keep your census up, and so you do that by reducing readmissions. At the same time is by you telling doctors and referral sources this, you are then able to actually increase your value because you're different among the rest. Understand this, eventually this is going to be a big thing, and this is going to be something that a lot of companies are going to be using. I have actually a lot of companies that I have referred to, Home Health Answering Services.com. They actually do this where they can set up for a minimum fee of as low as $5 a month. They can call every one of your per patient actually, of course. And so it's a minimum thing. If you have 100 patients, what's $500 if you can actually make sure that they don't get readmitted, and at the same time it increases the value of your company because doctors and referral sources and discharge planners are going to see this and they're going to want to use your company over the rest because you have this. So downstairs on this video you're going to see a link to and make sure you let them know that I referred you to them, or you just let them know that Home Health Success Academy referred you to the company. They're going to be able to give you guys a really good deal to be able to take care of your patients and at the same time increase value for your company and getting more clients and more referrals. So this is another healthcare marketing tip from Michael over here at Home Health Success Academy. Understand this, healthcare marketing is not hard if you know what you're doing. Give us a call. Let us help you go ahead and increase your census and at the same time have those phones ringing and have those referrals just rolling in. Thank you so much and have a great day.